Okay, good afternoon, everyone. Welcome. Welcome to our conversation on the current status of COVID-19, staying safe in phase 4 and beyond. This conversation is brought to you by the Chicago Cancer Health Equity Collaborative, ChicagoCHEC, which is a National Cancer Institute comprehensive cancer partnership led by Robert H. Lurie Comprehensive Cancer Center of Northwestern University, Northeastern Illinois University, and the University of Illinois at Chicago. Our mission is to advance cancer health equity through meaningful scientific discovery, education, training, community engagement. For months now, the COVID-19 pandemic has disrupted our lives and normal activities such as work, business, and social life. To protect the health and safety of indigents after the shutdown, states and city leaderships have established plans to safely open their economy in multiple phases. In today's conversation, we have experts who will provide information and answer your questions that you may have on the state of COVID-19 in Chicago and staying safe during these unprecedented times. So here, today's conversation is also sponsored by the Bristol Myer Squibb Foundation funded project, which is called the University of Illinois Cancer Screening Access Awareness and Navigation Project. Before we get started, I would like to take a moment and let you know that today's conversation is being recorded. Everyone is currently on mute, but you can type any questions you have in the Q&A session down below, and during the question and answer, we will be able to unmute yourself and ask the questions you have. I am Ifeanyi Beverly Chukwudozie. I'm a site director for ChicagoCHEC at the University of Illinois at Chicago. I would like to then now introduce our experts who will be joining us today. We have Dr. Melissa Simon, who is the Vice Chair of Clinical Research with the Department of Obstetrics and Gynecology. She's also the George H. Gardner, MD Professor of Clinical Gynecology. She's Professor in Obstetrics and Gynecology, Preventive Medicine, and Medical Social Sciences. She's also the Director of the Center for Health Equity Transformation, CHET, and also multi-site Principal Investigator for ChicagoCHEC. Also with her, we have Mr. Saul Yala. Mr. Saul Yala is part of the Communicable Disease Program in the City of Chicago Department of Public Health. He oversees a team of investigators who investigates communicable diseases, cases such as tuberculosis and now COVID-19. Since the beginning of December, he has been following the trajectory of this pandemic with a team of epidemiologists from the city of Chicago. He will be sharing with us also the safety precautions that we will be following in the city's current phase and beyond. Thank you both for joining us today. Please, if you would give us an overview of your work related to COVID-19 pandemic. We'll start with Dr. Melissa Simon.
Hi, good afternoon, everyone. Thanks for joining us today. I direct ChicagoCHEC and with other directors across Northeastern and community members and UIC, but I also direct the Center for Health Equity Transformation at Northwestern, and within that role I serve on the mayor's racial equity rapid response team, the provider committee, but also the Illinois COVID-19 team, as well as Illinois Unidos, which is the state of Illinois' Latinx population response to COVID. So from those perspectives, and as a OBGYN who's actively caring for patients, even as I speak from the triage unit at Prentice, those perspectives really get me to, where we're at now. If we think about how we've been opening very cautiously, the city specifically. We just went to phase 4 opening around just near the end of June. And that phase 4 was really supposed to be opening several industries, restaurants, health and fitness, movie theaters, museums, zoos, and allowing gatherings from 10 people to a maximum of 50 people. And that was back then, a month ago, the 7-day case positivity rate, was around 2.5%. But now, as we start to see other states surge in cases of COVID and also with deaths, we in Chicago we start to see more gradual, like going back a little bit on that phase 4 guidelines. And as of Friday, the restrictions started to be like no longer being able to serve customers indoors with respect to bars and breweries and stuff for that had alcohol for consumption on site. And then there was like maximum party size at a table up to 6, and then indoor fitness classes to 10. And then there were all the universal masking remains essential. And also 6 people per unit gatherings for residential properties. So all those things are really important, because as we start to see, the point is that this is a marathon that we're in, and that people can't think about this in 1 month, 2 month, 1 week time. This is with us. COVID is with us for, probably a year at least, if not more. But, because we're not going to have a vaccine anytime soon. And even when the vaccine is discovered or through all these through the phase 1, phase 2, phase 3 trials, then they've got to actually package the vaccine and distribute it. And that distribution and that vaccine is not going to hit all populations equally, right? This is global. This is not just for the United States, but it's also for different populations who may not have participated in the trials. And we can certainly talk about that later, because I want to be mindful of time. But, who participates in trials, like, for instance, the Moderna trial, which is the one that was published most recently in New England Journal of Medicine, 89% of those participants were white adults. Yet the proportion of those cases that are hit most hardest by COVID are Latinx and Black populations. So again, we need to be very mindful of this, as well as vaccines for youth, pregnant persons and older persons, and persons with immunocompromised status. Those vaccines might not be tested yet for those populations, so they may get distributed to those populations much later, so well beyond a year or 2. So we need to think about all of that as we move forward through COVID.
Thank you, Dr. Simon. And now I'll give the floor to Mr. Ayala to give his overview, and I will actually stop sharing my screen because he may want to share his.
Yeah. So as Dr. Simon was talking about, we did move closer and cautiously to reopen our city, and that's only been a month, if you can believe that. So with the opening of certain restaurants, bars, things of that nature, and some neighboring states opening their beaches, going to those kinds of places, it did, people do travel to those places to have time, which I understand, people want to enjoy their summer. However, following certain precautions like face masks, keeping people's distance, as soon as this opened up, we were able to go out and enjoy each other's company. However, let's not forget that we're in this together, let's not forget that this is a long haul before we can relax. And I understand the difficulties of doing that, especially when you have young children, young adults, adolescents who just want to hang out. They just graduated and they want to resume their party, which I understand. However, as you can see in my screen that I'm sharing, right now, you know, this is the daily summary, and anybody can obtain this information by going to chicago.gov/COVID, going under where it says latest data, which is right here in this section, and then obtaining the daily summary. This will give you a sense of where we're at with how we're doing. So right now, as of today, or yesterday actually, there was 59,160 cases that were confirmed, 427,837 cases, people that were tested. And there's no more test restrictions. So if you feel like you were exposed to somebody, one of the things that has been said by our Dr. Awadi has been said that, you know, wait 7 days before you actually go to get tested when you've been exposed to a single person or maybe a congregate setting that you don't know who you were exposed to. You know, waiting those 6-7 days will give you a better accurate testing so that if you do test negative, you can rest assured that you are negative rather than testing the next day and it'll give you a negative result, and that result may not yet have been, your system has not been developed with a positive result, which would have been if you would have waited the 7 days. And so far, there has been 2,754 cases, and you know, that continues to drop. Death per day. However, any death is a tragedy. We also want to make sure that we want to also compare how we're doing as from previous days. And the day before we had 237 cases. Yesterday we had 229 cases, which gives you, you know, a negative or a drop of 3%. However, our positivity rate is still 4.9. And when we first started opening or reopening the city to phase 4, we were at I believe 3.5% positivity rate, which is what we were trying to do, stay within the 3.5 to 4% positivity rate. However, with people not following certain restrictions or certain facilities such as bars and stuff like that, there has now been a new increase in those places where there was no social distancing, and people were actually reporting that. And we did get several outbreaks or several cases that came out of those places. So that's why, as of July 24th, bars can no longer serve just alcohol in those places. I know that people have been, you know, making, you know, doing the outside bars and all of that and maintaining social distancing. So if we continue to do that, we can resume those places to reopen again fully. Again, that all depends on how the virus comes and how we see those numbers going. So as of now, we're still monitoring every single case. There has been a lot of contact tracing, and what that really entails is calling people who have been exposed and asking them to self-monitor for 14 days, reporting to the city if they did test positive or if they actually have symptoms, and advising them where to go and how to get tested. It's very simple. It's a very simple test that you can actually go to a drive-up facility, minimal, wait times at this point. So you don't even have to wait that long. So there is no excuse not to get tested. But one of the things that we are finding is that some people are refusing to answer their phone calls, are refusing to talk to the Department of Health to get some of these things answered. And again, for the Latino community, one of their concerns is my name going to get published? Is my name going to get out there? Due to certain things that they've experienced in the past through other agencies or maybe through other things. So they're a little skeptical about the city, which could be understandable. However, we're trying to provide a service to keep the Chicago public safe and to reduce and to overhaul and stop the spread of this disease, this virus.
Thank you so much. Thank you both for that great overview and summary so far. I haven't seen any questions in the Q&A, and everyone can unmute themselves and ask a question if you'd prefer. But I will ask the first question in terms of how effective is the measures, protective measures that we have right now, which is the hand wash, the mask, and social distance. Are there other ways we can protect ourselves?
Well, one of the things that we have talked about is reducing your amount of time that you're in public, reducing your trips to the grocery stores, things of that nature. I mean, if you want to take a walk with your family, to do it within your neighborhood, to do it, not going to parks and things like that, which we enjoy, but if you can limit that, to make sure that if you see someone else, a runner or a jogger or a walker like you, respect them, respect yourself, and put on your mask. Keep your mask with you so that in case, you can say hi and all of that. Waving is fine. We've enjoyed doing that, but keeping your distance. I mean, if you're walking, I know some of the stores have put aerials kind of like to make sure that people are flowing and people are not coming in together, facing each other, but instead we're walking. I know it sounds a little bit military and it looks very military, but this is where we're at. We have to get used to it, and I don't believe that it'll be that inconvenient when you know the dangers of it. When I'm sure Dr. Simon has experienced or has treated patients, family members. I know we have several family members who passed away, and that's hard.
Yeah, I mean, I agree with Saul. This is a big issue. We got to keep the mask. We got to maintain physical distance as much as possible. It's really hard for certain populations and communities and households to do that, especially multi-generational households. I can speak for my community, Latinx households. And that's why groups like Latinos Unidos or Illinois Unidos, exist so that we can start to help spread the word and have more trusted communication with communities that really need it, because that's key right now. Like I said before, we're in this for a marathon. This is not going to be over anytime soon. And by the time a vaccine is produced, it's going to be another year or so from now. We need to be very realistic about this, that this is life. And it only takes one exposure to one person to spread that disease. It's a virus. It's just like you cough on somebody, even if we didn't have COVID, you know, last year, if somebody coughs on you or starts to sneeze, you guys, it's a natural response to kind of move away. Well, this is no different, but we've got to keep a mask on and be very vigilant about that. And that mask needs to be, just like I'm demonstrating, because I'm in the OB emergency room right now, it has to be across that nose, because when people are doing this, your nose is actually more contagious than your mouth. Wow. And you get more more spread through your nose as well. So cover your nose and your mouth. And for children, it's really important to get them used to a mask, right? We get children used to and ready for school. It's really important to get them used to a mask, whether they're going to school in person or not. You've got to get them used to a mask, because even if they go to the grocery store with you or somewhere, you've got to keep their mask on. So they need to get used to it as well.
Thank you so much. Go ahead.
I have a question. Hello?
Yes, go ahead, Dr. Ben Levy.
All right, thank you. How you doing, Dr. Melissa? Good to see you. Dr. Beverly? Good to see both of you. I have really two questions. I mean, I have a lot of questions, but two questions. And one of them is that while they're talking about this 6 feet distance, we kind of know that when spores come out of people's mouths, they can shoot as far as 20 feet. And that's really problematic. And of course, I agree with you 100%. People are out here with the mask covering their mouths, but not their noses, failing to realize that you can also get infected straight up through the nose, because it's all one system. You know, that's why they call it eye, ear, nose, and throat. And so I think that some of it is trying to allay people's fears, but they fail to realize that this is a pandemic. This is very, 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 very serious. And so they need to look at that. The next thing I wanted to ask about, I really don't even hear many people talking about it, is even when they find a vaccine, which, you know, to think that it's going to be at the end of this year or maybe even next year, it's almost absurd because there's all this competition that's going out there. A lot of people haven't talked about the ultimate end of the process there, and that's pricing. How much is this drug going to cost? And how many people are going to be able to afford to pay for this drug? It's particularly those who won't have any medical insurance, considering the way things are going right now. So I just want to know what your thoughts were on that. And then I'll be quiet here, let other people talk, because you know me, I can talk a lot.
Thank you. Do you want me to answer Sal first, or? I mean, either way, it's fine. I know we both. So, Dr. Ben Levy, good to hear from you. Absolutely great questions. Yes, you can sneeze very far. So 6 feet, though, is kind of like a minimum distance we recommend. That's the average stuff that comes out of your mouth and nose. So that's average. Again, we have to message consistently. So we can't really say 20 feet. That would be near impossible in many cases. But keep the mask on, because masks, the proper wearing of mask completely helps reduce that spread. It really does. In terms of the vaccine, yeah, it goes on to what I was saying before. They have to distribute it, right? Package it, distribute it, and then it will go to certain populations over others. My number one point of this is make sure everybody votes. Whoever you know, whoever you touch, every single community member, they have to register to vote and vote. Because by the time we get to the vaccine distribution, who is in the leadership position, the highest leadership in our land, and along not only with the President of the United States, but the Congress, who is in our leadership will determine how this health insurance or coverage is going to play out for the vaccine. So we can talk about all the craziness that could happen all day long, but the most important thing for everybody on this call to do, and then have their other friends and family reach out to their networks and through their networks, et cetera, is register and then vote. They must vote. because this is the most important thing, because it will be on the CDC, and because the CDC is where this stuff will go, and you know, the Affordable Care Act, if that's still going forward, you know, these are things that are really important to have vaccine distribution to everybody equally, fairly as well.
All right, thank you.
One of the other things that I just want to add to that is that the city of Chicago does have a very good immunization program. We have been preparing as of right now to do our flu vaccine, getting that you know, ready to go. So when it is safe to vaccinate, we won't be mass vaccinating the way that we used to. Some colleges, some of my family members are like, Saul, am I going to be able to go to Wright College and get my flu vaccine this year? And at this time, I do not know. However, we are planning to vaccinate and provide the vaccine to our residents as soon as possible and as soon as it is safe and in a safe way. So the immunization program and the immunization team has been talking about that. They've been in conversations about that, how to distribute, how to advertise it to the African American community, how to advertise it to our Latino community. This is very important because if you have the flu vaccine, that'll protect you. And because COVID, the signs and symptoms are very similar to the flu. So we don't want you to go into a hospital or anything like that because you have flu-like symptoms or mistaking that you have flu-like symptoms when in reality you have COVID. So those are the two things that we want to stress, that if you can or if you want to get the flu vaccine, there will be a chance for you to get your flu vaccine. And medical providers that can also provide that are going to be able to do that. So we're rolling it up and getting that thing started so that so that we can provide the vaccine. However, how that is going to look like, it will be different this year, definitely.
Thank you so much. Something that I know we already have a few questions that I'll be going into, but in some of our previous conversation, one of the things that were brought up to us by some of our community partners is the cost of the COVID-19 testing. Is this free, and is it free for undocumented indigenes or individuals?
Yeah, so if you drive up to any of the sites, and they're all over the city of Chicago, there is a list of sites at chicago.gov/COVID. It'll give you a list of facilities where you can get tested. Most of them are open Monday through Friday from 9 to 5, but they try to close at 4. Just to make sure that the line stops at 4 so that everybody can have an opportunity to get tested. They do not ask for your medical insurance. They do not ask for anything. All they want to know is how can we reach you so that you can be notified of your test results. So that's another thing that I want to stress to our population. Please provide your full name with the correct telephone number, because there has been incidents, and I see this on a daily basis, that they call themselves Mickey Mouse and the telephone number is not correct. So how are we going to tell Mickey Mouse that he has tested COVID? So if you want to give a false name, that's fine. Or, I mean, we do not encourage that at all. Nobody's going to know that you came to get tested. We do the best that we can for confidentiality reasons. We cannot provide that information to anyone else other than you. So give us your direct telephone number so that the city of Chicago can provide that information directly to you. If you have a child, make sure that you, the parent, are the ones to put your name and put the child's name, but ask them to call you directly.
The other important point is that the collection of data, racial ethnic data, is really important because funding for resources for the communities most impacted by COVID is actually follows the data. So if the data don't have race or ethnicity attached to it, then they become a left blank case. And so we don't know, is that a Latinx person? Is that a Native person? Who is that? An Asian person? We don't know. And the way government funding is allocated is by the data. So when you have the appropriate reporting, then that can help allocate the appropriate amount of resources.
Hi, I have a question.
Go ahead.
Thank you. This has been really helpful, a lot of information. I had a question following up the testing. I'm not sure if the data was already on the graph that you showed us earlier, Mr. Ayala, but I was wondering, is there any data out about where individuals are getting their testing done, or which locations are doing most of the testing? Is it the drive-ups? Is it the FQHCs? Or where is most of the testing taking place for citizens in Chicago?
Right. There is a that information available. If you go, like I said, to the latest data dashboard, you can look it up by zip code, and that would be where you would get it. However, if you require more additional information regarding like specific, whether it's FQAC or the drive-ups, I'm not sure if I have that information available, but I can certainly get it or try to get it for you if you would like.
Okay, thank you. That would be great. And I'll take a look at the website because I hadn't really got a chance to look too much, and I'm sure it's probably is on there, like you said. And I did have one more follow-up question regarding the drives up. Just being new to the city, I moved here a year ago from Dallas, and I just learned very quickly that this is a big public transit city. And so for people who don't have cars, and the drive up is like a big thing, what are citizens doing to get tested that don't have a car to do the drive up? Where can they go get testing?
There are a lot of FQACs, federally qualified clinic health centers that do the testing. If you type in your zip code, it gives you 10 different sites or 5 different sites, depending on where you're at, to give you just a number. Several of our city clinics are doing testing. Not all of them, but several are. You can get that list again through our online. If you put in your zip code, and it'll tell you whether you need an appointment, especially if it's in a building, they would want you to make an appointment. I'm not sure if they're accepting walk-ups at this time or walk-ins, as you would call them, but you would have to call that specific clinic to let them know that you're coming, or to ask them, do you accept walk-ups? And if they say yes, then, you can go right there. But it goes through your city zip code, and that will give you the places where you can go.
Okay, thank you.
And they're also all free, and no sliding fee scale at all. They're all free.
Perfect.
Thank you. Thank you so much. So we do have a few questions in the chat. I will start with one from Nisha. The question is, in some cases, people are not receiving results for 1 to 2 weeks after they get tested. How might this affect the data? And do you think a test result that comes back weeks after collection is still useful in light of potential exposure during that time?
It's not useful. It's not useful. Our testing in this country has failed miserably. We are trying the best in Chicago right now to do the best we can. Like in the hospital, our test turnaround time is very fast. It can be 15, 30 minutes sometimes a little bit longer, but that's it in the hospital for admissions. So in the community, we have to do better, because anytime so when you get tested, that test is only for whatever you've been exposed to right until that time you get that test. So as soon as you leave the testing center, you could get exposed to somebody else, and that could change your status right there, right? Because again, this is an infectious disease. Infectious disease means wherever you have new exposure, you have the opportunity to get positive. So I hope that point is emphasized and is clear.
Thank you. Ms. Ayala, do you have anything to add to that?
No, I agree with Dr. Simon. I think a lot of people need to restrict themselves to one activity per day. That way you know that that's where you were exposed. Now, if you go to certain activities where you have 3 or 4 exposures, that becomes really hard to maneuver and to kind of pinpoint. And the contact tracing for those many exposures is going to be hard to do. And also to keep in mind where you've been. Try to keep a log of where you've been and who you've been in contact with, who you've been talking to for more than 15, 20 minutes without a face mask. Or even with a face mask at this point, because a lot of people say they have a face mask, but it's not carried on properly, and sometimes I see people where they're talking, and then their face mask keeps coming down, and by the time they finish their sentence, there's no more face mask. So, just keep in mind that.
Yeah, and that leads us to our next question. Does the contact tracer leave a message for the individual to contact them? Has there been an effort to have public service announcements in Spanish and other media informing Latinos about contact tracers and why it is important to answer their calls? I think that after maybe Mr. Ayala kind of responds to them, Dr. Simon, if you could talk about contact tracing and why is this important?
Yeah, so we have, the state of Chicago has developed a questionnaire for contact tracers to provide both Spanish and English. If the person who's talking to you is not Spanish speaking, they will transfer you to someone who is Spanish speaking. We also have a language line to help assist with other languages that are a little bit more difficult to get those languages because they're not as common. However, we do have a language line to assist with the language barrier. We have been, effortlessly trying to get people to respond to the contact tracing, because the sooner we're able to notify the people that you were in contact with, the sooner it'll be that they can either get tested or quarantine if they have to. So there's a lot of benefit from answering one phone call.
So contact tracing is really important. We're doing a lot of work around that. There is a series of grants being put out through the Chicago Department of Public Health, also the Illinois Department of Public Health, to there's an umbrella organization for community organizations to hire contact tracers, and there's also an umbrella for federally qualified health centers, community health centers, to hire contact tracers. Right now, there's also a lot of work being done around who the contact tracers should be. And this goes back to my earlier comment about if we have accurate racial ethnic data reporting, we can better advocate and ensure that the contact tracers look like the communities being impacted by COVID. So for the Latinx community, for example, and the African American community, it's really important that we have contact tracers who really know that community, and who can speak the language and who can have cultural humility with those cultures, and so that's really, all these things are really, really important, and they're all connected in many ways. So and there's a very deep-seated distrust, you know, from decades of racism and segregation in this city that also have to be overcome, because people are calling you with health information, and so you have to be able to trust that information from whomever that is giving it to you. So there are a lot of issues around contact tracing and making sure the protocols are culturally relevant and appropriate and in the right language. And then there's the second step of how do you then support a person who needs to isolate, who may not be able to, or needs extra resource referral and support in order to get through those 14 days of quarantine.
Right.
Thank you. And we have a question from Caesar. And the question is, what additional measures are being taken to further protect seniors that live in senior housing facilities?
Right. So what the city is doing, that we do have a specific unit that is addressing that population. We monitor how many reports are coming in. We have a unit, like I said, that does a lot of follow-up with the medical director or the nursing director of the facility director, to make sure that they're reporting accurately and they're reporting timely as well, so that we do not see an uptick in any of those settings anymore. As you know, or many of you know, that at the beginning of all of this, that's where a lot of our cases were coming from. However, we have seen a very good response from the medical directors, the nursing directors of these facilities that have implemented a lot of protocols to make sure that their residents do not become infected. Or if there is a case, making sure that they are isolated and that they're quarantined during that 14-day period. We also want to make sure that if there are any residents, any family members that are not able to visit, to make sure that they're taking temperatures, that they make sure that nobody comes in without a mask. These are some protocols that have been worked out. And so those are the kinds of measures that we are taking to make sure that long-term care facilities are no longer affected at a high rate as they were at the beginning of all this. So we have to be mindful. And for those of you who have family members in some of these facilities, I know how hard it is, but please be patient. I know it could take a minute to get into the building and see your family members, but take that time appropriately so that you yourself and your family members, and you're protecting everyone else in your community. Because you have to, one of the things that we stress is that if you have a family member that is in a nursing home and you're going to visit them regularly, just assume that you're that person. So if you are that person, then do not go shopping every day, do not go to some of these places, because you are exposing yourself and enhance exposing your family member at the same time.
Thank you. And I would like to pose the same question to Dr. Simon. You deal with pregnant women. Are there any extra precautions that are suggested for pregnant women?
It's the same. So that was a very good question, and so that was a good answer. So yeah, it's the same. Everybody is at risk of getting COVID, whether you're a little kid or an elder adult or a pregnant person. And that needs to be emphasized. This is a contagious disease, okay? And so what you have to do is practice right? We're all in this together. We're all on the same planet Earth. COVID is not, you know, functioning over boundaries of states or cities. It doesn't function over, it doesn't care who you are. It will infect you if it has the opportunity. That's the bottom line. Doesn't matter if you vote red or blue or purple. It will infect you if it has the opportunity. And so given that, pregnant people, just like elders and people who have loved ones who are older, need to put a mask on. They have to wear a mask all times. It's not going to hurt you. Your oxygenation doesn't change when you wear a mask like this. And it is really important to remember that. In the hospitals, again, if you're a pregnant person and you're going to the hospital to give birth, you have to remember that, or into your clinic appointment, you wear a mask. In the hospital, if you're admitted, we swab everybody who's admitted into the hospital. So your partner that you bring in with you also has to wear a mask at all times. And as a pregnant or birthing person, when you're on the labor floor, once your COVID test is confirmed negative, then you can take your mask off. Not the partner, not the loved one or the birthing support person who's with you, only you as the patient. And those are important. And if you are positive for COVID and you're on the labor floor, you're in a separate isolation room, you're in a separate unit. In our hospital, it's an absolute separate unit on a separate floor. In some hospitals, it's the same floor, but a separate room. Most hospitals will restrict visitors and not allow visitors at that time. So again, we're not trying to be mean. We're not trying to be accusatory or in any way, shape, or form. We're trying to keep everybody as safe as possible. And so I hope that makes sense in the answer.
Thank you, definitely. We do have a question. So what would need to happen for us to go back with restrictions to phase 1, for example? Like, is there anything that would happen to make us go back to phase 1?
The positivity rate goes up and we start to have a positivity rate that goes up so high that we worry about the capacity of our intensive care units and our hospitals to take care of emergency departments, to take care of people, right? We have to be very mindful of that spread and be very mindful of our capacity to care for people. Quite frankly, many of us, including myself across the nation, healthcare providers signed on to a petition to actually start the entire country as one back to phase 1. I don't know where that will go given the current political landscape, but you know, there are good evidence to suggest that if we actually did the entire country back to phase 1 and for 6 to 8 weeks, we actually have a higher chance of trying to mitigate and reduce some of this spread in a better way, so that things like schools can perhaps function better if they open, right? So.
Thank you. And we have a question that asks, any advice for those parents concerned about the return of their children back to school?
So I'll start. You know, this is a hard one because schools are such important parts of a child's life and a family's life. They're important resources for more than just education. I'm sorry, there's a code going on, so I apologize for the background noise. But you know, schools are important resources for food and safety and emotional and social development and all of these things that serve families really importantly, especially in some communities across Chicago. So, you know, it's a hard one. If our rate is going to start going up, then, you know, I'm hoping that the education and the families, again, are flexible with going back and forth, because the opportunity to get infected in school is going to be there. There's adults in school, there's kids in school. Kids may not get as sick as others, but we still have a lot of children who have chronic diseases like obesity and asthma that actually, and diabetes, and those impact the outcomes of COVID actually. So, and then we have families, and then we have a whole bunch of staff. It takes a village to run a school, including the teachers. So we need to be really mindful of all of those things when school starts. Also getting children, again, used to these masks. It's not easy, especially for the younger ones and for the teenagers for that matter. I have 4, so I know. these are all important considerations as we go back. And then to, again, just like Saul mentioned, to be flexible. That, you know, once an outbreak happens, the school is going to close down for a while, or at least classrooms will close down. So there's going to be the need for flexibility, which is really hard for some families, especially the ones that have to work and don't have other ways to watch their children.
Thank you. Ms. Ayala, do you have anything else to add to that comment?
No, I mean, I agree with Dr. Simon. Most of the parents, you know, I'm a parent too. I want my kids to go to school and have, you know, those kinds of experiences. Social development is very important for their, you know, growth. However, doing it safely is better. And one of the things that you mentioned earlier was, you know, how would this look like if we were to go back? So this will depend on how children have been instructed to wear their masks, how teachers enforce that, and cleaning, sanitizing, all of that, you know, is going to be an added burden to the teachers. So as parents, we want to make sure that we're helping as much as we can, teaching our children to be responsible for their own space, to have it clean and neat. And, you know, there is no time for playing around, as sad as that may sound, but there is really no time for that. We have to, if we want to keep going forward to phase 5, we have to do what we have to do in phase 4. We cannot go forward without doing what we have to do now. And again, one of the things that we have to be mindful is having our flu shots, because if there's one kid who's sick, that'll infect everybody else. And whether you think you have COVID or you have the flu, at this point, we are not going to, you know, second guess the health and risk of everybody else.
Thank you. There is a question about what work accommodation can be extended to recent, and I'm guessing, cancer survivors under 3 years during the pandemic. And I will pose this to Dr. Simon.
I'm sorry, what work?
So it's the work accommodations that can be extended to recent cancer survivors under 3 years during the pandemic. So is there any work accommodations that survivors should keep in mind as they get back to work during this pandemic? So survivors that have been 3 years, within 3 years or under 3 years.
Yeah, I mean, I think it's really important for, especially for cancer survivors, recent cancer survivors who may be more immunocompromised than those who are more 10 years out from cancer diagnosis, to be mindful about workplace accommodations. Preferably the goal would be to work from home, but I know that not everybody is able to do that. And so really having the right masks, the right physical distancing, and appropriate protections are critical. As well as continuing in care. And if there's any concern, to get tested. Those are really important things, but also, again, limiting exposure. Don't go outside to get groceries. Can somebody else get them for you? Or if you have to go, try to concentrate your time out as little time as possible out as possible, and not to expose yourself to things like indoor settings, like restaurants and things like that, beauty shops, bars, beauty parlors. So again, limiting your exposure is really important. And I do want to call out that some workplaces are not, and I'm glad Illinois is moving towards more restrictions and requirements, but some workplaces still, it's shamed. You're shamed almost and could get fired for being COVID positive. And so it's really important to understand what your rights are as an employee. And if you can't get those from your employer in terms of your rights, then there are websites both on City of Chicago and also Illinois level around workplace protections, because workplaces need to provide you the proper PPE and the protections, whether you work in a meat packing plant or in a health center. You have to have the proper PPE, personal protective equipment like masks, etc., for yourself. So those are important considerations for everybody, but also especially for new cancer survivors.
Thank you. And then we have a question of how can we determine if the air quality in the working environment is safe in a school or classroom? So this is air quality in working environment is safe in a school or classroom. Can we determine if the air quality is safe?
So I don't think I can answer that. That's beyond my knowledge. I mean, I get it that those are important considerations for schools. I assume there's some kind of regulations through CPS. Sal, do you know? Because I don't.
You know, I have not heard that question being asked, to tell you the truth. But however, there are restrictions for workplaces, and that could be something in there. However, I have not seen that. Air quality is more used more for lead or asbestos abatement, those kind of things, and that you would find it under the buildings inspections or under environmental health. So those unfortunately are questions that I cannot properly answer.
Thank you. And we have a question. I know we've answered part of this question, which was what would testing look like for people without cars? And I know Ms. Ayala mentioned that there are federally qualified centers that people can go to. But the second part was how great is the risk of being exposed while trying to get tested if you can't do a drive-through testing? Or how safe, I'm not sure that was what was being asked. How safe is, if someone is not doing a drive-through, how safe is trying to get tested without going through a drive-through?
One of the things that most of the federally qualified clinics have put together as a protocol is to test one person at a time, maintain the lobby or the waiting area with a minimal number of people, sometimes they have to wait outside the clinic. Those are kind of things that they have put in place that I know of. However, I'm not sure for specific clinics. You would have to see that, you know. But however, if you go in there and there's too many people, you know, just keep in mind that if you're going in there by yourself, do not take your children, do not take anybody else that does not need to get tested. And make sure that you're maintaining your social distance. Some people get offended by you asking them to step back, or if you step forward. However, this is the environment that we're living in. So making sure that that you feel comfortable enough to go in there, knowing that, you know, if you get a number, the test is rapid. It's not going to take more than 5 minutes. Sometimes all you have to do is fill out a form. They give you a form before you even walk in, so that your exposure to the facility is minimal.
Thank you. And I will pose this to Dr. Simon. Someone asked, NECA asked, what is the validity of the vaccine?
There's no vaccine developed yet. So I think you're talking about efficacy, not validity. So we don't know yet. We got to wait. Part of the issue of speeding through trials is that there might be some efficacy sacrifice, meaning a coverage of maybe 50 to 60% protection versus 60 to 70% or 80% protection. So we won't know until the final vaccine or set of vaccines are completed, the trials are completed. So we really have to wait, but it goes back to who is participating in the trials. I can't emphasize that enough. We got to have more diverse representation, and I know that's a big ask, but I think the onus is on the investigators and investigative teams who are getting hundreds of millions of dollars to make these vaccines, make sure that there's diverse participation in trials, and partner with community organizations and partner with academics who, for me, for example, who can help improve that participation and that thoughtfulness of making sure there's representation so that the output, those efficacy studies, are relevant to the populations they need to serve.
Correct.
Thank you. And Dr. Benlevy wanted to inform us that he's also a certified contact tracer, and he said this was great and good to see you all. And then our next question is, I know that this is important not to delay necessary medical care, but how safe is it to go to the doctor or dentist during this time? Is it worth it to go and get preventive care?
So we're doing everything we can to have preventive measures to prevent COVID transfer. So if it is an annual exam or a cancer screening test that you need, or just an annual checkup, it is important to have it. You could probably delay for a little while longer. It just depends on your personal situation. In terms of vaccines for your children, going to the pediatrician, a lot of pediatricians' offices are taking every precaution possible to ensure the well child visit. I know that because of the volume is being decreased to physically space patients out, you might not be able to get that annual physical exam for the well child checkup until after school starts. But again, these are important things to attend to. But again, you have to wear a mask, follow the procedures of the clinic. Everybody's got to wear a mask who's going in. There's a balance. But the important thing is if you do delay an annual exam or a checkup or cancer screening, for example, it's important to remind yourself, figure out how to remind yourself that you've got to then get it in the next year or so, or as soon as possible. It really depends on your situation. And at the end of the day, if you have any questions, you should call your healthcare provider, whether it's your pediatrician or your adult healthcare provider or your oncologist, and you can work out a plan with them for when it's reasonable for you to come back. The final thing I want to say is that there's hybrid visits now. So there's visits online, so by phone or by video. And these are a good alternative. So if you have any healthcare related questions or mental health questions, you can definitely reach out to a healthcare provider and do it virtually first. And then you both can determine when or if you need to actually go into the clinic for further testing or for an actual in-person exam.
Okay. We have two more questions. What advice can you give concerning touching face surfaces? If you wear a mask and, for instance, you grocery shop or receive a package from the mail, how do you deal with this? Do we clean everything off, or does it matter?
Wash your hands. Wash your hands. Soap. Very important. 2 minutes. Happy birthday twice, or whatever you want to do twice. All surfaces, including the thumbs. And the packages, if you're really, really concerned, you can wait 3 days in the box if they're not perishable. That should kill anything. 3 days it tends to be the average going line. But in general, you don't have to worry that much about that. But that's what I would say. But wash your hands.
Okay, we do have one more question, and the question was about, do we know if the recent protests have any impact on the rising rate of positive cases?
So the uprisings, we don't really know. I mean, for the most part, most people who are up and out are wearing masks, which I really appreciate. I think people are exercising their right appropriately so, but are doing a good job of wearing masks, and that's what we would encourage. There's a lot of factors that go into the increasing rate of positivity, and it's not necessarily from uprisings.
Thank you. And so I think that we have answered most of the questions. I will go ahead and continue to share my PowerPoint slide. Okay, sorry. Okay, thank you everyone for attending and joining us and for your wonderful questions. I want to especially thank both of our experts, Ms. Ayala and Dr. Melissa Simon, who is in the clinic, and thank you so much for giving us time to talk to us. We also wanted to mention, thank you also for those that have worked behind the scene to make sure that that this virtual conversations, community conversations keep going on. We want to also inform you of our upcoming event, our large virtual community forum. We've had community forums in the past. This year we're going to have it virtually for 2 days. It will be September 17th and 18th, and both days it will start from 11 a.m. to 1 p.m. Central Time via Zoom. More details to come, and here these are most of the topics we'll be talking about. We'll also have raffle prizes for those who register, and it's a free event, and information will be passed on through our Facebook page, website, and Twitter. I also, like I said, thank you so much, Dr. Simon and Ms. Ayala, for such a wonderful, very informative event, and thank you everyone for your wonderful questions.
Thank you.
Thank you.
Thank you so much. Bye, everyone.
Thank you.
Bye-bye.
Thank you.
Thank
Bye.
you.
Thank you.
Gracias, Saul. Thanks, Beverly.
Thank you.
Thank you so much.
Yes, thank you, Beverly.